National Doctors Day 2025, honoring the healers who heal us. Every year on July 1st, India commemorates National Doctors Day, a solemn yet celebratory occasion that pays tribute to the tireless service and sacrifices of medical professionals. Doctors are the backbone of any healthcare system. Their dedication, expertise, and compassion play a vital role in saving lives, promoting well-being, and guiding individuals through their most vulnerable moments. In 2025, this day takes on added meaning with the official theme, Behind the Mask, Caring for Caregivers, which urges society to look beyond the professional persona of doctors and acknowledge their personal challenges, emotions, and needs for care. National Doctors Day in India was instituted in 1991 by the Government of India to honor Dr. Bidhan Chandra Roy, a pioneering physician, freedom fighter, educationist, and the second Chief Minister of West Bengal. Dr. Roy was born and passed away on July 1st, making the date symbolic and historically significant. During his lifetime, Dr. Roy was instrumental in shaping India's healthcare infrastructure. He helped establish vital institutions such as the Indian Medical Association and the Medical Council of India. Furthermore, he was a visionary city planner responsible for founding important cities like Durgapur, Bidanagar, and Kalyani. In 1961, he was awarded the Bharat Ratna, India's highest civilian honor, recognizing his vast contributions across medicine and public service. The theme for National Doctors Day 2025, Behind the Mask, Caring for Caregivers, draws attention to an often overlooked truth. Doctors are not immune to stress, fatigue, and emotional exhaustion. While the world sees doctors as resilient and composed professionals, many suffer silently under the weight of their responsibilities. This theme challenges society to recognize their emotional and mental struggles and calls for tangible support systems to care for them in return. Doctors often face intense pressure emotionally and physically as they navigate long working hours, make life-altering decisions, and offer care in high-stress environments. During the COVID-19 pandemic, this reality became especially apparent. While the world was indoors, doctors were at the front lines, risking their lives to save others. The pandemic exposed the extreme vulnerabilities that healthcare workers face, not just from disease, but also from exhaustion, burnout, and emotional trauma. Several credible studies conducted in India highlight the mental health crisis among doctors. A major survey among Indian resident doctors revealed that 67.2% suffered from moderate stress, 30.1% showed symptoms of depression, and over 90% experienced burnout. Even more troubling, 16.7% admitted to having suicidal thoughts. Among faculty members, nearly 28% were at risk of burnout, and 12% were at very high risk. These findings reflect an urgent need for institutional reforms and support systems tailored to the well-being of healthcare professionals. Factors contributing to this crisis include excessive workloads, lack of institutional support, increasing patient expectations, administrative burdens, and even the risk of violence or abuse. Unfortunately, while doctors are trained to heal others, very little is done to ensure that they themselves remain emotionally and mentally healthy. Doctors are much more than just medical professionals. They are mentors, educators, counselors, and often a source of hope for patients and their families. Their role extends beyond clinical treatment to building trust and instilling strength in those suffering from illness. Whether it is a surgeon who operates under extreme pressure, a pediatrician who eases a parent's worry, or a rural practitioner who serves isolated communities with limited resources, every doctor makes a meaningful difference. Over the decades, India has produced countless medical professionals who have transformed the healthcare landscape not only nationally but globally. Indian doctors serve in leading positions in hospitals and research institutions around the world. Historical figures such as Dr. Kadambini Ganguly, one of India's first female doctors, and Dr. Ranjit Roy Chaudhuri, a pioneer in medical ethics and policy, have laid the foundation for ethical and advanced medical practice in the country. Honoring doctors on this day can take many forms. Patients and citizens can express their gratitude through kind words, thank you notes, or even heartfelt gestures on social media. Institutions and governments can host award ceremonies, wellness workshops, and seminars focused on the mental health of doctors. Schools and universities can organize essay competitions, debates, and interactive talks to inspire the next generation to consider medicine as a noble profession. Thoughtful gifts such as medical books, journals, or items that contribute to a doctor's clinic or personal well-being can also serve as tokens of appreciation. Most importantly, policymakers and healthcare institutions must take active steps to implement systemic changes, such as regulating work hours, providing mental health support, and creating a safer work environment for doctors. Although India celebrates National Doctors' Day on July 1st, the global community recognizes doctors on International Doctors' Day, which is observed on the first Monday of October, October 7th in 2025. Both observances serve a common purpose: to recognize the selfless work of doctors and to remind society of their indispensable role. National Doctors' Day is more than a ceremonial occasion. It is a moment of reflection, respect, and renewed responsibility. In 2025, as we celebrate the healers among us, we must also remember that they too are human, deserving of care, compassion, and dignity. As we offer our gratitude, let us also advocate for a system that supports their mental health, professional growth, and personal fulfillment. After all, in caring for our doctors, we strengthen the very foundation of our healthcare system.